So today we will be talking about the directional terms, how you can refer to different body regions with respect to one another. And so we're going to learn some of the terms looking at the anterior view. And when looking at the anterior view, we're always assuming correct anatomical position. And so this means that the person is facing forward with palms facing also forward or outwards. We're also going to be considering the lateral view and then referring to some directional terms in that position. So to begin, when looking at the anterior view, we are going to start with top versus bottom. Top is also known as superior. The opposite of superior is inferior. So if we're talking about body parts with respect to one another, we can say the head is superior to the feet. Another word for superior is rostral. Sometimes you can also see that as cephalic. All of those mean head, rostral, and cephalic, since in humans or upright creatures, the head is the most superior region. Another name for inferior or word that we can use would be caudal, also referring to the tail, since the tail or the tailbone in humans is inferior. Next up, let's go ahead and look at some new terms, and this time we're going to be looking at the limbs. When considering the limbs, such as the hands as well as the feet, we can think of them as an axis. The region right here is closer to the axis of the body, and then the region right here, the fingertips, would be farther away from the axis of the body. Similar for the hips. Right here, this is closer to the axis of the body, and then the feet or the toes are going to be farther away from the axis of the body. So these words, closer and farther away from the axis of the body, have specific terms. The word proximal can be referred to an area that is closer to the body's axis. The opposite of proximal is distal. So this means farther away. From the body's axis. Okay. Similar for the feet, proximal would be the area closer to your hips, and distal would be the area closer to your toes. So if you wanted to practice, you can say, for example, the knees are going to be proximal to the toes. The elbow is going to be proximal to the fingertips. We can also say that the fingertips are distal to the elbow or to the shoulder. Next up on this medial or anterior view, we're going to refer to new terms that we will now call medial and lateral. This time we're going to be looking at an axis that goes from left to right. Medial refers to the middle, versus lateral would mean to the side. So for example, let's say we look at the ears. We can say that the ears are lateral with respect to the nose, and the nose is medial with respect to the ears. Now let's move on to the lateral view. And so now you know by now this means side view. Right? Lateral means side. And so when we're looking at the side, we can notice that there is a front and a back side. Right? So the front side is also known as anterior. Another name for anterior in an upright creature such as a human is ventral, meaning belly, and that's because our belly faces anterior or forward. The opposite of anterior is posterior. So this usually refers to the back side, also known as the dorsal side. So in this scenario, for example, we can say that the chest is anterior or ventral to the back. The back is posterior or dorsal to the belly or to the chest. Okay. And then finally, the last pair of terms that we are going to be discussing would be superficial versus deep. Superficial refers to body regions, body tissues, or organs on the surface with respect to something that is deeper, meaning more internal. For example, we can say that the skin is superficial to the muscle or to the bone, because we know that muscles and bones are deep or underlie the skin. And there you have it. These are the directional terms that we will be using throughout the semester.